Welcome to the Medi-Cal RX Reinstatement Phases 2 through 4 webinar. Let's take a look at our agenda for today. The agenda today will include the phase reinstatement. We will discuss Phase 4, lifts 1 through 4, as well as how providers can prepare. Lastly, we will review some helpful contacts and resources. Now let's dive into the phase reinstatement. We will begin by covering the phase reinstatement. The foundation of the implementation of this plan is focused on stakeholder feedback and preparedness, performance monitoring, and nimble adjustments. This purpose aligns us with our objectives to reduce disruption, as well as ensure safe and timely delivery of pharmacy benefits. First, let's look at our reinstatement roadmap. Phase 2 included 2 separate waves, which began January 20th and February 24th, respectively. Phase 3 included 4 lifts total, beginning March 24th through June 23rd, to retire the transition policy for members 22 years of age and older. Phase 4 began in a series of lifts, with Lift 1, which began August 4th, Lift 2 began on September 22nd, Lift 3 began on October 13th, and Lift 4 began on November 10th. Please note that reinstatement of PA requirements for enteral nutrition products for members 21 years of age and younger will not occur prior to 2024. Next, let's take a more detailed look at each phase. Phase 1 included 3 separate waves, which encompassed the reinstatement of Claim Edit DUR Reject Code 88, promotion of Cover My Meds for PA submission, and the reinstatement of PA requirements for 11 STCs for New Start prescriptions affecting members 22 years and older. Phase 2 included 2 separate waves, which encompassed the reinstatement of 39 STCs and the reinstatement of 46 STCs, including medical supplies. Additionally, we began the preparation for the retirement of the transition policy. Phase 3 included 4 separate lifts, which retired the transition policy for members 22 years of age and older. Lift 1 retired 12 STCs and 6 HIC-3s. Lift 2 retired 17 STCs. Lift 3 retired 22 STCs. And Lift 4 retired an additional 46 STCs. Phase 4 Lift 1 impacted 3 claim utilization management edits for members 22 years of age and older, and impacted NCPDP Reject Codes 60, 61, and 606. Phase 4 Lift 2 included the reinstatement of cost ceiling claim edits and reinstatement of PA requirements for New Start Enteral Nutrition Products for members 22 years of age and older. Lift 3 was implemented with the reinstatement claim utilization edits for Reject Code 76, Plan Limitations Exceeded, for members 22 years of age and older. Phase 4 Lift 4 retired the transition policy for all pharmacy benefits, as well as reinstate PA requirements for all therapies for STCs for members 22 years of age and older. Lift 4 also reinstated brand medically necessary PA requirements for all claims. As more details regarding Phase 4 become available, information will be posted in advance to bulletins and news, FAQs, and highlighted in the weekly reinstatement spotlight. Prescribers may, when clinically appropriate, transition members from non-contract drugs to products on the contract drug list and covered products list, reducing the need for PAs. Next, let's discuss Phase 4. Medi-Cal RX is moving forward with reinstatement for members 22 years of age and older, with the initiation of Phase 4 through a series of lifts impacting claim utilization management edits, such as age limits, labeler restrictions, quantity limits, diagnosis, etc. Phase 4 Lift 1 impacted claim edits for members 22 years of age and older. A 30-day alert was published on July 3rd to the Medi-Cal RX provider portal. Let's briefly look at what was impacted by this lift. The following NCPDP reject codes were reinstated during Phase 4 Lift 1 on August 4th. NCPDP Reject Code 60, Product Service Not Covered for Patient Age. NCPDP Reject Code 61, Product Service Not Covered for Patient Gender. And NCPDP Reject Code 606, Brand Drug Specific Labeler Code Required. NCPDP Reject Code 60, Product Service Not Covered for Patient Age. Medi-Cal RX reinstated age limit requirements on claims for members 22 years of age and older. Reject Code 60 was reinstated for claims of all STCs except enteral nutrition products, including but not limited to the Code 1 restriction listed in the Medi-Cal RX contract drug lists. NCPDP Reject Code 61, Product Service Not Covered for Patient Gender. Medi-Cal RX reinstated gender requirements on claims for members 22 years of age and older. Reject Code 61 was reinstated for claims of all STCs. Claims submitted for Medi-Cal, CCS, and GHPP were not impacted by Reject Code 61. Claims submitted for family pack members are impacted by Reject Code 61. Please note that the Department of Healthcare Services removed current gender requirements for all Medi-Cal Rx claims except for family packed. NCPDP Reject Code 606, Brand Drug Specific Labeler Code required. Medi-Cal Rx reinstated labeler code requirements on brand multi-source drugs where the brand name is less costly than the therapeutically equivalent generic alternatives for members 22 years of age and older. Code 1 labeler restrictions can be found in the CDL as well as in the supplemental message returned upon claim adjudication. On September 22nd, Phase 4 Lift 2 was reinstated for members 22 years of age and older. A 90-day alert was published on June 23rd, as well as a 30-day alert on August 23rd to the Medi-Cal Rx provider portal. Let's briefly look at what was impacted by this lift. This slide lists the 3 STCs, 68, 86, and 87, that were impacted by Phase 4 Lift 2 as of September 22nd. This applied to new Start Enteral Nutrition Product claims for members 22 years of age and older. Please note that members 21 years of age and younger will not be impacted. On September 22nd, Phase 4 Lift 2 impacted the reinstatement of utilization management claim edit for Reject Code 78, cost exceeds maximum. To improve pharmacy claim submission, processing quality, and to mitigate potential fraud, waste, and abuse in Medi-Cal Rx, the previous $10,000 cost ceiling limit has been revised. This slide lists cost ceiling limits for OTC, generic, single and multi-source brand, and high-cost generics and brands. The updated policy will apply when a point-of-service pharmacy claim exceeds the dollar claim amount threshold as specified in the table, and claims will reject for Reject Code 78 with the following supplemental message that you see here on the screen. Please note that members 21 years of age and younger will not be impacted at this time. Drug classes that are exempt from the cost ceiling requirement include, but are not limited to, the following: blood clotting factors and related treatments for hemophilia, treatments for cancer, immunosuppressive and immunologic agents, HIV and hepatitis C virus medications, gene therapies and other select targeted biologic therapies, and specific disposable medical supplies, diabetic testing supplies, insulins, and compounds. Additional drugs exempt from cost ceiling requirements can be found in the Medi-Cal Rx Provider Manual. Submitting PAs, cost ceiling claim edits for Reject Code 78. Reject Code 78 requires approval of an override with clinician review to receive a paid claim. In order to resolve Reject Code 78, providers should confirm that the claim is submitted accurately and validate that quantity, billing units, and day supply are correct. Consider less costly alternatives, if clinically appropriate. For a list of potential alternatives, providers can consult the contract drug list and the covered products list. Now, if the claim is being submitted accurately and alternative therapy is not appropriate, submit a prior authorization. Additional information required to review a Reject 78 includes the following: full SIG, quantity, and day supply. Clinical reviewers will utilize this additional information to assess the appropriateness of the cost ceiling override based on FDA-approved guidelines for the drug or indication. On October 13th, Phase 4 Lift 3 was reinstated for members 22 years of age and older. A 30-day alert was published on September 13th to the Medi-Cal Rx provider portal. Let's briefly look at what was impacted by this lift. Reject Code 76, plan limitations exceeded, applied to new start claims for all ages and applies to refill claims for members 22 years of age and older as of October 13th. Claims that reject with Reject Code 76 can also reject for the following reasons: minimum billed quantity, maximum billed quantity, day supply limit exceeded, quantity limit exceeded, maximum quantity per day limit exceeded, and number of fills per specific time limit exceeded. To resolve Reject Code 76, providers are encouraged to review quantity limit requirements included in the contract drug list and covered products list on the Medi-Cal Rx web portal and consult the following resources: specific manufacturer's prescribing information and FDA-approved dosing. If resubmission of the claim to meet quantity limitations is not appropriate, a PA request is required for coverage consideration. Point-of-sale overrides are not available. When applicable, submit a prior auth request via one of the 5 approved Medi-Cal Rx submission methods. Now, please note, Covered products may have quantity limits not listed on the CDL that are reflective of sound clinical practices and FDA-approved dosing. Prescribing above a Code 1 quantity limit will require prior authorization approval. Additionally, if a claim rejects due to quantity limitations exceeding 100-day supply for drugs or products, a PA request is not reviewable for coverage consideration, as it must meet this limitation of up to and including a 100-day supply, except FDA-approved self-administered hormonal contraceptives. This includes transdermal patches and vaginal rings, in addition to oral dosage forms, and sodium fluoride products, drops, and solutions. On November 10th, Phase 4 Live-4 was reinstated for members 22 years of age and older. A 30-day alert was published on October 10th to the Medi-Cal Rx provider portal. Let's briefly look at what will be impacted by this lift. As of November 10th, Phase 4 Live-4 has been implemented for members 22 years of age and older. Phase 4 Live-4 impacts the retirement of the transition policy for all pharmacy benefits for members 22 years of age and older, reinstatement of PA requirements for all therapies for standard therapeutic classes 68, 86, and 87, which includes enteral nutrition product requests, both New Start and ongoing therapies. The reinstatement of brand medically necessary PA requirements for all claims. Additionally, reinstatement of Reject Code 80, Code 1 diagnosis requirements will occur no sooner than 2024. Please note that members 21 years of age and younger are not impacted. Effective November 10th, the transition policy has been retired. PA requirements are reinstated for all therapies for STC 68, 86, and 87 for members 22 years of age and older. Enteral nutrition products are included in these STCs and require a Medi-Cal Rx PA for any requests for members 22 years of age and older. Coverage criteria for requested products apply, and medical necessity documentation must be included with each request. Members 21 years of age and younger will not be impacted. Now let's talk about submitting PA requests. All enteral nutrition products require a prior authorization. Providers can refer to the list of contracted enteral nutrition products for more information on Medi-Cal Rx's covered enteral nutrition products, as well as the NDC list for covered NDCs. Additionally, prescribers can refer to their e-prescribing application. For pharmacy providers, an enteral nutrition claim is eligible for PA submission if it presents with the supplemental messaging that you see here on the screen. PA requests can be submitted via the 5 approved Medi-Cal Rx submission methods: Cover My Meds, Medi-Cal Rx Provider Portal, NCPDP, P4 Transaction, fax, and U.S. mail. Please note that PA requests submitted for enteral nutrition products for members 21 years of age and younger will not be accepted at this time. Next, let's talk about brand name medically necessary PA requests. Claims submitted with a dispenser's written code of DAW1 for a brand multi-source product when the product is not subject to a label or restriction for the brand drug will deny for brand medically necessary PA requirements. This has been reinstated for claims for members 22 years of age and older. Please note that claims submitted for brand multi-source drugs that do not have a maximum allowable ingredient cost or federal upper limit price type will not deny for brand medically necessary PA requirements. Reject Code 80, Diagnosis Code Required. Medi-Cal Rx will reinstate Reject Code 80, Code 1 diagnosis requirements on claims for members 22 years of age and older on a separate date in early 2024 and will be reinstated for a limited number of medications listed in the Medi-Cal Rx contract drug list. A list of medications requiring Code 1 diagnosis with the diagnosis codes that will be accepted on the submitted claim without PA request will be published prior to reinstatement. DHCS will utilize diagnosis codes gathered from previously submitted medical and pharmacy claims to meet this requirement, as well as diagnosis codes submitted with the prescription or a pharmacy attestation submission clarification code of 7 that the diagnosis meets Code 1 requirements. Before we conclude our presentation, we want to provide you with important contacts and resources. Resources and information regarding the Medi-Cal Rx reinstatement, including the links found on this slide, can be found on the Medi-Cal Rx Provider Portal under the Education and Outreach tab by selecting Medi-Cal Rx Reinstatement on the left. In addition to these resources listed, the Reinstatement Weekly Spotlight is published to bulletins and news every Friday and provides the most up-to-date information on all things reinstatement. Allow these resources to come to you by signing up for the Medi-Cal Rx subscription service to receive the weekly spotlight and future alerts directly to your inbox. Here, you'll see a compilation of links to our contract drug list as well as our covered products list. But the most important message that we want you to take away from today is that the Medi-Cal Rx team is here for you. We encourage you to review our website resources. Our pharmacy service representatives are available to provide you assistance via office hours Monday through Friday from noon to 1. In addition to support the ongoing efforts regarding reinstatement of enteral nutrition products, we have dedicated Wednesday's office hours for additional questions specifically regarding enteral nutrition. Also, our customer service center is available 24 hours a day, 7 days a week, 365 days a year to provide around-the-clock support. Additionally, you can email the Education and Outreach team at medicaleducationoutreach@magellanhealth.com. Lastly, we encourage you to sign up for our subscription service, which will provide emails to your inbox directly regarding Medi-Cal Rx updates. Here, we've included helpful links to efficiently navigate through Medi-Cal Rx resources. And that will conclude our presentation for today. Thank you.